Today, we're diving into why more nurse practitioners are considering starting their own private practices. What do you think is driving this trend?
Honestly, I think autonomy is a huge factor. NPs often want more control over how they provide care, from patient scheduling to treatment approaches.
That makes sense. When you're working under someone else's rules, it can feel limiting. Running your own practice, you get to set your own standards.
Exactly. And with autonomy comes the ability to really shape the patient experience. Some NPs find that in larger settings, patients become numbers.
Right. In a private practice, you can build long-term relationships. That personal connection is so rewarding for both sides.
Plus, there's the flexibility. Managing your own hours is appealing, especially for those balancing work and family. Ever tried juggling shift work with school pickups?
Oh, that's a classic struggle. Private practice allows NPs to create schedules that actually fit their lives, not the other way around.
And let's not forget about professional growth. Running a practice means wearing many hats: healthcare provider, business owner, leader. It's challenging, but so satisfying.
True. The learning curve can be steep, though. Suddenly you're handling everything from payroll to marketing. Not exactly something they teach in nursing school.
That's for sure. But many NPs see it as a chance to grow beyond traditional clinical roles. It's about stepping out of the comfort zone.
There's also the potential for increased income. Owning a practice can be financially rewarding, especially if you fill a community need.
Yes, but it's not just about money. Many NPs are motivated by the chance to serve underserved populations or focus on specific health issues.
It's like being able to choose your own adventure. Want to specialize in women's health, chronic disease, or mental health? You can tailor your services.
And by doing so, you can make a bigger impact. It's not just about treating illness. It's about promoting health and prevention on your own terms.
But starting a practice does come with risks. There are upfront costs and regulatory hurdles. It's not for the faint of heart.
Absolutely. Licensure, insurance, compliance, there's a lot to navigate. But for many, the benefits outweigh the challenges.
I've heard some NPs worry about isolation, though. Going solo can mean less daily interaction with colleagues.
That's true, but many join professional networks or collaborate with other providers. Technology helps too. Telemedicine, online forums, you name it.
Good point. And running a practice doesn't mean working alone forever. Many NPs hire staff or bring in partners as they grow.
Also, having a private practice allows for innovation. You can pilot new care models or integrate alternative therapies without red tape.
That's exciting. You can respond to patient needs quickly, test ideas, and see immediate results. It's like being an entrepreneur in healthcare.
And for patients, that often means better access and more personalized care. No more waiting weeks for an appointment.
Plus, NPs who run their own practices often report higher job satisfaction. They feel their work truly reflects their values.
I think that's key. When you're aligned with your mission, work feels less like a job and more like a calling.
Exactly. But let's be real. The first year can be rough. Finding patients, handling paperwork, and staying afloat financially, it takes grit.
For sure. But there are resources out there, mentors, business courses, even social media groups full of advice.
And every success story started with that first leap. Sometimes the fear of failure is the biggest barrier.
True. But with careful planning and support, many NPs find it's the best decision they've ever made.
So, would you say private practice is right for every NP?
Not necessarily. It depends on personality, goals, and tolerance for risk. But for those who crave independence and impact, it's worth considering.
And even if you decide not to start your own practice, learning about the process can deepen your understanding of the healthcare system as a whole.
Absolutely. The more options NPs have, the stronger the profession becomes.
So, for nurse practitioners listening, maybe it's time to ask, what does your ideal career look like?
And what steps can you take today to move closer to that vision? Even small actions can add up.
That's a great note to end on. Thanks for joining this conversation. Hopefully it's sparked some ideas.
And if you're thinking about starting your own practice, remember, the journey may be tough, but the rewards can be life-changing.